symptom over both your nose and mouth. Question number 12 is in the name of Sterling Jeffery.
To the Minister of Health, does he believe that New Zealand's health system is adequately equipped to support and treat mental health needs?
The Honourable Andrew Little.
Mr Speaker, this government has started the process of rebuilding our mental health services, and that work is not yet complete. So in that respect, we have a system that still does not meet the demands placed on it in a timely way. To put that in perspective, at the very start of this government, we commissioned a review of mental health services because they had been neglected for a period of time. That review made a number of recommendations, including giving priority to filling the biggest gap in mental health needs, which was services for those with mild to moderate mental health issues. As a consequence of that review, in 2019, we invested $1.9 billion over 4 years to improve mental health services, alongside additional funding for hospitals, the Department of Corrections, the Ministry of Education and the Ministry of Social Development, for each of them to step up their mental health services. We committed $455 million to put frontline mental health workers into GP and community clinics. 3 years into that program, we've contracted for nearly 1,000 new roles doing this work. This includes 142 specifically for youth services, 184 for kaupapa Māori services, and 59 for Pacific services. There's also additional funding for Rainbow specific providers. In this year's budget, we provided an additional $100 million for acute mental health services, with an emphasis on child and adolescent services, eating disorder services, and places in the community for those who've been acutely unwell to continue their recovery safely. We are not there yet, and there is more to do.
Supplementary question, Sterling Jeffery.
Supplementary. How will the Minister measure the success of delivering $1.9 billion of funding towards mental health services?
Mr Speaker, what we're seeing already is a rapid increase in the availability of services to people, particularly those with mild to moderate mental health needs, getting access to that advice quickly and easily. That is already being seen in alleviating pressure on hospital-level services, the more acute end of mental health services. So while we've added more people to primary care services and alleviating pressure there, we haven't seen a growth in waiting times for acute services, but waiting times for acute services still remains a challenge, and we'll continue to work on that.
Further supplementary?
Mr Speaker, does the Minister have faith in the Ministry of Health to deliver mental health services, or could a new Ministry of Mental Health better serve these needs?
Mr Speaker, we've just done a massive reorganisation of health services. So, for example, whereas before we had the Ministry, we had 20 district health boards and a host of other organisations, we have now taken out the 20 district health boards. We have one organisation, Te Whatu Ora Health New Zealand, which was responsible for the delivery of all public health services in New Zealand and supporting primary care to do the same. In addition to that, we took the work that the Ministry does for disabled people, and we have established a standalone ministry for disabled people. So they get a focus not only on their health needs, but their social support as well. I'm confident that with the structure that we've got, with a more focused leadership and greater consolidation across our system, we will see an improvement in the delivery of mental health services across our system.
We come to question number 13 in the name of Mika.